Hi, I'm Mike Duggan. I've been teaching restorative dentistry for over 32 years now and to over 6,000 dentists. This video shows how I do it. Real-time, mannequin-based, hands-on, point of view, and patient real. If you are a pre-dental student, an aspiring teacher, an international dentist, join me at Duggan Oral Design, dugganoraldesign.com. Okay, and of course, as I indicated, we're going to use the mirror very carefully to make sure we see up the A-plane once I've prepared it. So we're going to look up this direction. So you can see initially this groove, the accidental type of these ridges are not really well defined, but I'll probably keep the grooves on my A-plane of my lower prep approximately where they are now. And I'm going to angle the burr downward so that it's likely to give me a plane that's matching the vertical angle of the opposing tooth. And I want to get those ridges in the right position. The distal one I'll probably move mesially a little bit, and I'll probably move them both just a little bit mesially. But that's the first step, making these grooves. And make sure the grooves are in the right place. Keep checking with respect to the opposing anatomy. It's what's telling you where to put the grooves. Then you can go between the two grooves, back and forth like this. And then from this groove up to this embrasure over here. From this groove all the way over to the embrasure here. And then check to see how you're doing. The time to check clearance is before you have enough. I'm going to repeat that. The time to check your clearance is before you have enough. You can always reduce a little more. You can't reduce a little less, right? Okay, so I don't have enough clearance over here, so the burr should fit in each of these places. Doesn't quite fit yet. But you see it's starting to look like it's fitting the basic anatomy of the opposing tooth. But we keep defining those grooves really nicely. So it's well-defined grooves and just round over the cusps. Okay, still need some more. But again, we're emphasizing the definition of those grooves and making sure that we have the vertical angle matching the opposing ridges there. Okay, so now we're almost there. This typodon's not super well equilibrated. Okay, so see the way it's starting to fit the opposing tooth now? So take your time. Make sure you're really happy with this plane before you move on to the next plane. If you under-reduce the A plane, then you can't see as much of what you're doing on the B plane, so that's counterproductive. Okay, take your time, get the vertical angle, get nice uniform clearances as much as you can. That's what we're looking for. It should look really nice and uniform all the way across. So that's what I want the examiners to see. Notice that I'm looking in the mirror so I can look right up that plane. If you were to try to look at it this way, you wouldn't see anything. So we look up the plane in the mirror, then you'll be able to see what you need to. Now I can see that I don't have any clearance on these B ridges yet, so I'm going to reduce them. So the mesial buccal, I'm going to reduce this way. I'm going to keep the end of the burr in the central groove, and I'm going to come all the way down right next to the adjacent tooth and reduce that marginal ridge. Then I'm going to come down this way and then bring the end of the burr out the facial groove. So I'm following the end of the burr goes down the central groove, out the facial groove. Point the burr in the right direction, have the vertical angle matching the adjacent tooth. Follow the central groove, come down to the marginal ridge, come out the facial groove. Then let's check the clearance. Okay, so I can see I'm getting some clearance right in there. You would be able to take a ball burnisher and slide it over there. Almost. I'd probably do a little bit more. Again, down this plane, out the facial groove, down this plane to the marginal ridge. Then we have a well-defined ridge, and we can see how much clearance we have right in that area. Now over on the distal buccal, now I'm going to point the burr this way, tangent to the corner of the adjacent tooth. I'm going to bring the end of the burr out the facial groove, and then come down this way, all the way to the distal facial groove, and then come down the distal cusp like this. So 3 planes. Plane 1 coming out here, plane 2 coming down here, plane 3 down the distal cusp. Now I can look through this way and get an idea as to how much clearance I'm getting there. Not getting very much. I've got plenty on the mesial buccal, but not much on the distal buccal yet. So I'm going to reduce some more. But again, with the burr always pointing in the right direction. Plane 1, 2, and 3. 1 out the facial groove, 2 to the distal facial groove, 3 down the distal cusp. Okay, now I'm trying to get some clearance. With a ball burnisher, I could measure that clearance. I suspect the ball burnisher won't fit quite yet. So let me get a ball burnisher and I'll check it out. Thank you. So I want to slide the ball burnisher right over this ridge when the tympanont's closed, and also over this one. So I'm going to close it down. I can get it over the mesial side and have some extra room there. Over here, it doesn't quite fit through there yet, so not even a millimeter clearance there yet. And we want 1.3 to 1.5, so let's do some more. But again, keeping it pointing in the same direction. Okay, I can see there's a little bit more now, so let's measure it. Okay, so up at the top, not quite getting through, down a little bit closer to the central groove. I'm getting the ball burnisher passing through close to the central groove, but not so much up here. So if I make the plane a little bit more horizontal, if I make the burr a little more horizontal, I'm reducing more at the top of that ridge without reducing much more at the groove area. So again, we can evaluate that as we go. Okay, so now it fits over in both areas, so we're pretty good. It fits, and there's a little extra room too. Now let's do the distal buccal, or sorry, distal lingual right here. So I'm going to make a guess that it should be maybe shifted distally a little bit. So we're going to try it, and then we're going to check the location and the clearances by using the bite registration material. I'm going to come down this way and follow the distal lingual groove, and then come out the distal groove, or the lingual groove, and then come down this way, all the way to the marginal ridge here. Now I won't be able to see much looking this way. I'll have to use the bite registration material to help me evaluate what's going on there. Notice that I'm coming out the lingual groove, so I'm reducing. With these 2 planes, I'm reducing part of the mesial lingual cusp. When I come down here and out the groove, I'm reducing part of the mesial lingual cusp. So now I'm just going to reduce the rest of it to make it more even. So I've reduced around it. Now I'm going to reduce the top so it evens up. Come down to the marginal ridge this way, then I'm going to come all the way down here. Down here and out the groove, down here to the marginal ridge. Okay, so again, flat plane down here, bring the end of the burr gently out the lingual groove, flat plane to the marginal ridge. Flat plane down here, bring the burr gently out the lingual groove, flat plane to the marginal ridge. Over here, flat plane to the marginal ridge, flat plane out the facial groove. Over here, out the facial groove. down to the distal facial groove, then down the distal cusp. Okay, so what I'd want to do now is use some bite registration material. So I'm going to go ahead and check this, especially in the distal lingual area right here. So I'm going to make a ridge, or make a pencil mark on that ridge. We're going to make sure there's no dust on the prep, because the dust will make the impression material more opaque. So make a ridge here. Make the ridge and then mark it, and then the impression material is going to pick up that mark, so it'll give you a little bit of a orientation on where you are. We're going to then inject the material through the mixing tip. And then close it down. And again, it should be like 45 seconds before it sets. And then I'm going to shine a bright light through the other side and see if I can see any light areas. If I see any light areas, then it means we don't have enough reduction. So it's almost set already. I should say we don't have enough clearance. Okay, so let me take it out. So there's the prep right there. So let's look from the, I'll take a light. So you're going to turn, if you have a headlight, turn off your headlight first. Okay, so where the pencil mark is, it seems to be, there's not much light coming through there, is there? On both sides of that distal lingual ridge. So maybe toward the central groove, it might be a little bit under-reduced, but not too bad. Again, that's what we're looking to see. But up here toward the cusp tip, it looks like it's pretty dark on both sides. Now, one of the things we can do is check ourselves. If we're not positive about how dark this impression material is at various thicknesses, we can actually, when we're learning how to do this, not when you're taking an exam, but when you're learning how to do this, you might just go ahead and take the Typodont out of the mannequin and then hold it in your hand and use the ball burnisher and check from the lingual like this. So it turns out that right now the clearance is actually about a millimeter, toward the central groove it's about a millimeter, and then toward the cusp tips it's more than that. So that's kind of what the wax was telling us, is down in here we could get a little bit more clearance. The light was coming through there, but this area looked like it was reduced pretty well. Now if you look here, the mesiolingual cusp is taller than the distal lingual cusp. So all I would do at this point is try to make the height of those cusps equal. And that probably means we're getting enough reduction on the mesiolingual side while we're getting the clearance on the distal lingual. And I'd probably reduce a little more, again, toward the central groove over on the distal lingual. But otherwise, the bite registration material was showing us about what we need to see. All right, so you have both an example on the accidental, which is this one, and an example on the Kilgore as far as the basic anatomy, grooves, so forth. So you can compare both of those and see what you can do. Again, you notice this is what I want to see. In order to see that, we can see it easily as long as we're closing the Typodont down and looking up in the mirror. We can see exactly how it relates to the opposing tooth. This one over here, again, I close the Typodont down and look in the mirror so I can see exactly how it fits relative to the opposing tooth. So that's what we're looking for. Okay? All right, so you have both of these type of notes you can refer to and then get started on what you're doing. And I'll come around and check your workbooks pretty soon too. Yes? Okay, so here's number 3. And I'm going to go back to my 837 burr as usual. And you can see that these ridges are pretty close to where the opposing grooves are. The distal buckle is probably shifted mesially a little bit, so I can move it back to the distal. But I'm going to make very well-defined flat planes. I'm going to keep the end of the burr in the central groove. I'm going to cut as close as I can to the adjacent tooth so I get a longer flat plane. And I'm pointing the burr in the direction I want that ridge to go. And I'm going to check in a moment and see if I have the ridge in the position I want it to be. So now it's fitting. I'm going to shift it distally a little bit more, but it's starting to fit into the opposing tooth. You can choose the vertical angle from the adjacent teeth if you want, but we want to get a millimeter clearance. Let's go a little bit farther distally with that ridge. Now we're going to do this side over here. So again, 4 planes. We're defining 2 ridges. Make sure the ridges are exactly where you want them. Then we're okay. Let's take a look if I'm putting the distal buckle ridge in the right place. Nope, need to move it more to the distal, don't I? Again, we do a little bit, and then we adjust it. We do a little bit more, and we adjust it. It's trial and error. But when I'm looking down the axis, I can see the direction I'm pointing the ridges. And I can see I'm making nice flat planes. Then we look this way. I can see the clearance I'm getting in each of those areas. Now, for the B plane, as I said, I'm going to use direct vision, right? At least for the mesial buccal part of the B plane. This part in here, I'm going to use direct vision. That's what I wrote on the board. So I'm going to look this way. And I'm going to take the vertical angle from the adjacent teeth, like here. I'm going to start on the marginal ridge, which I've already reduced with the A plane. And I'm going to cut all the way through, keeping the same vertical angle all the way through here. All the way through from the mesial marginal ridge, all the way through the oblique ridge. Just keep going. And I can see how much I'm reducing every step of the way. And we want to end up with a clearance of 1.3 to 1.5 since it's a functional cusp. And we're just going to push it all the way through the oblique ridge. Some people try to preserve the oblique ridge, and that's a disaster. We're trying to reduce the oblique ridge. The lab will recreate the oblique ridge. We're trying to reduce all the way across. So this plane, notice it's very flat. It is not horizontal. It is flat. So we chose the vertical angle to match the adjacent tooth very carefully. Now I'm going to find the distal pit. Notice the head of the handpiece is behind the tooth over the second and third molars. So I'm going to make this groove starting from this pit, and the groove goes up diagonally. That's part of the distal lingual groove. So I'm doing one side of the distal lingual groove from the pit up this way. Flip the burr over, and now it's over the premolars, and then I'm going to come up from the distal pit and bring this side of the groove up this way. So now I'm getting a very well-defined groove down there. My oblique ridge is now continuous from here all the way around to there. And then the C plane, as I drew on the board, I'm going to point the burr this direction, right? Not facial-lingually, this direction. And then make a nice groove right here. So the distal lingual groove goes up the B plane from the distal pit and then down the C plane here. Point the burr this way and keep it pointing that way all the way around here. And probably the C plane is going to fit the opposing tooth beautifully. Now, how do you think we can check to see how much clearance we have on the B and the C planes? You're right. bite registration material. We're going to check indirectly. The only place that we can measure the clearances directly are the A plane. Right out here, we can measure these clearances on both sides of these ridges. But to do the B and the C planes, to check those clearances, we have to do it with some kind of material like bite wax or something like that. Okay, so now we're going to inject on the upper arch. I wish these impression materials were a little lighter in color, so it's easier to see through them and get an idea as to the thickness. But it was a really cool idea to use the light on the cell phone and just put the little bite registration material right over the top of it. I don't have my cell phone in here right now, but I think I'll borrow somebody's cell phone and try that right now. That'll be kind of neat. Who's got a cell phone with the light turned on? Can you bring it over? Cool. Thank you. Okay, now obviously you have to turn off your headlight if you're wearing a headlight or any other light. Get that turned off. Okay, so now let's take a look. So the A plane is over on the right side here, so I'll sort of point at it, maybe you can see. So the buckle ridge is right here on this side. So we know how much clearance there is there, so we're not particularly concerned about the color of the wax right there because we can measure it directly. Over here on the distal, this area right here that we do by direct vision, that looks like it might be a little bit light. You know, we're seeing the light through there pretty easily. The C plane, toward the mesial side, probably needs a little bit more reduction. Okay, maybe a little bit more around the distal lingual cusp here as well on the other side of that groove. Okay. So I'm going to do some more reduction on the B plane, that direct vision side. So right along here. So maybe reduce another 0.5 millimeter all the way across there. But you can see clearly how much you're reducing all the way. End of the verve follows the central groove, all the way through the oblique ridge. Then let's do a little more on the distal side of this groove here. A little more on the mesial lingual C plane right around here again, keeping the burr pointing in the right direction. We can finish the C plane around the distal lingual just by rotating the burr a little bit here. Not a big deal. Okay, so that's probably about right. But of course you'd check it again with the bite wax or bite registration material, whatever.